Hi, I'm Mario Racci, Congress Chair for the Pharmaceutical Sciences World Congress 2010, which will be held in the thriving and exciting U.S. city of New Orleans. Our cultures will cross and our minds will meet, so we can share and explore ways to improve global health through advances in pharmaceutical sciences.
The impact of the global community of pharmaceutical scientists, I think, just mirrors in many ways the global phenomenon that we're seeing throughout our time in all areas, in finance, in economics, in science, in all those areas, that if you don't take note of what's going on around the world, then you work in isolation, and really that many of the things that you think are important others may have done, or that if you think it's important and you can express it on a worldwide community, you have much greater impact than you do just staying at home and busying yourself in your own lab. I think we've gone way beyond that now, and we're really a community, and the geographical distinctions really blur as we've moved along.
Well, I've seen especially that one country alone cannot solve the problems very often in the country anymore. And task forces that have been created, for instance, for countries that cannot, for example, have enough medicines for the people in their countries. The access to medicines is a big problem. So you have united efforts like Global Fund, and also we have Unit Aid and other task forces helping those countries to get the medicines that the people need. And of course on the other area that national governments and also authorities that work together a lot more, not only because trade has increased, but also to find solutions together.
The global community of pharmaceutical scientists is also something that developed over the last, say, 10, 20 years. In the past, it was very clear that organizations at a local level, they did their job, they did a good job in bringing pharmaceutical scientists together. But that was not enough. You work with subcritical masses of scientists. So it was very logical that there was this trend, this move to develop a global community of pharmaceutical scientists.
If you look at drug development, this has changed quite a lot. Drug development was done by big pharma in the 80s and 70s in the last century. But now, many things are done by spin-off companies, and they have to develop the drugs to a certain stage, and then big pharma is interested and they buy the licenses. So this has changed quite a lot. So really the drug development is going through a change and is still going through a change.
As a professor of pharmacy, I really encourage students in master degree and also in PhD program to be educated in other countries and to exchange between all European countries using the grants given by the European Union. I also encourage students to move in Asia and also in America. And if you look at colleagues working in pharmaceutical sciences, in academia, or also in industry, you will meet the concept of globalization. This is a world community today, and I think that pharmaceutical sciences are a unique example of globalization.
The Pharmaceutical Sciences World Congress, in conjunction with AAPS, I think will be a landmark. What makes this one, the 2010, I think, be landmark, is that this is a real partnership. This is a partnership whereby the AAPS, which has its annual meetings, has decided that the way in which it will actually interface with the Board of Pharmaceutical Sciences of FIP is by means of opening its annual meeting to work in conjunction with this Pharmaceutical Sciences World Congress. So together, really melding the global arena with the real strength and power of the AAPS. And I think that's what will make it a landmark, because if that is successful, which I firmly believe, then that will lay a pattern around the world.
Well, one of the first things I hope, and that will certainly come out, is the networking, because when you have a number of scientists from different countries, they watch what others are doing, and of course they also have their input. So I really would believe that the results of the Congress would be to have more collaboration, probably new teams, and also hopefully new ideas for new results and research, and or that others are finding their solutions already in the talks of their colleagues.
In New Orleans, what I really hope is that this family of pharmaceutical sciences that gets together, that works together. We are talking about medicinal chemists, we are talking about pharmacokineticists, those who work on simulation models. We look at people who work on developing new and better delivery systems, clinical experts, the experts in the regulatory sciences, and beyond that, pharmacovigilance is a new emerging field that we have never heard of 10 years ago. So this group gets together, works together, and its goal should be to get us new and better medicines.
What I like on this conference is that it covers the entire pharmacy, and pharmacy is dealing with everything around the drug discovery and development, the production, the biotechnology, the pharmacokinetics, and all the fields in pharmacokinetics, in drug quality, drugs in the environment, and so on and so forth. And this is really an advantage of this marvelous conference in New Orleans. And what I am expecting is that I can visit sessions which are not in my field but close to my field, and sessions which are science which is influencing my field even though I'm not in the field of the other people. That is really an advantage of a world conference in pharmacy.
PSWC in New Orleans is a catalytic event for this community of pharmaceutical scientists, allowing to define the future direction of pharmaceutical sciences. Sciences are moving so quickly today that we need this big event to be successful for young pharmaceutical scientists and also for senior people working in this field.
I'd like to close by taking this opportunity to invite all my friends and acquaintances that I've seen over the years who have attended the Congress, and all the pharmaceutical scientists worldwide, to take this opportunity, this unique opportunity, to actually come to New Orleans, to meet with colleagues, and so that we can all contribute to the overall welfare and health of the citizens of the world. So I look forward to seeing you in New Orleans in 2010.
Chers collègues, je vous invite sincèrement de réfléchir si vous ne voulez pas participer au congrès l'année prochaine à New Orleans. Le congrès international pharmaceutique scientifique va être extraordinaire avec une grande quantité de scientifiques, de sujets super intéressants et surtout aussi une opportunité de rencontrer beaucoup de scientifiques de partout au monde. Allez-y et n'oubliez pas, il y a aussi un peu de plaisir à New Orleans. Il y a du jazz. À bientôt.
Ich würde mich freuen, wenn ich meine Kollegen aus Deutschland und anderen Ländern in Europa, zum Beispiel auch Österreich und der Schweiz, auf der Konferenz in New Orleans 2010 begrüßen könnte.
More for French people and French-speaking pharmaceutical sciences, New Orleans is really a big event because, as you know, New Orleans is a very old French city and a great number of people are spoken French. So bonjour, Nouvelle-Orléans, je suis très heureux de vous inviter à participer au PSWC 2010 à la Nouvelle-Orléans. Tous les amis qui sont aussi bien des Canadiens francophones que tous les francophones de tout le monde entier, je vous invite à participer à cette manifestation des sciences pharmaceutiques et de la pharmacie mondiale.
New Orleans, 2010, that's the place to be. Pharmaceutical scientists from all over the world will be there together and will work in a translational manner on developing and designing new and better drugs. You better be there, otherwise you miss something. Not something, you miss everything.